Hey everybody, there's going to be a lot in this to digest, so bear with me. Last week I did a video about COVID-19. We had a great conversation about it. It was robust, lots of information. I had planned on doing something different today, but the incredibly disappointing news out of the state of California and the Southern County region of the Bay Area, where we're going to continue our lockdown through May 30th. That's in the face of science, of data, of medical knowledge, of epidemiology. It's so disappointing it got me to do this. I'm going to talk about two things. I'm going to talk about anchor bias, and I'm going to talk about the difference between signal and noise. These are things I learned in a class, by the way, at UC Berkeley called Sense, Sensibility, and Science, and it was taught by three professors led by the amazing Nobel laureate astrophysicist Saul Perlmutter. So we're going to come back to that. One of the things I wanted, and the idea of the class was to get us to think about how we should do public policy and how be an informed citizenry. So one of the things that I want to talk about is why public policy is so hard. It's because of two sides of the same coin. On the one side, we're more interested in rubbing our opponent's face in our victory than we are in actually making sure that that outcome gets embraced. I call this the Judge Judy effect. Judge Judy, either the plaintiff or the defendant will be winning. The other person's just getting blasted by Judge Judy. They're losing. And the winning party will inevitably want to rub their opponent's face in and start talking. And Judge Judy will say, does it sound like you're losing? No, then shut up. That's the Judge Judy effect. The flip side is people's inability just to say they were wrong, right? Even when the outcome they're experiencing is so much better than if they were right, what they would have been right about. So being wrong is actually better, but they just can't say they were wrong. It's an odd little thing of human nature. So I want to talk about this. And I want to start with New York, right? So we're going to start with an anchor bias. An anchor bias is the first piece of credible information that you get. It doesn't have to be right, it just has to be credible. And that bias then informs how we review and treat information around that anchor. And I'm going to give you an example. In the state of New York, if I asked you how many children under the age of 9 have died in the state of New York due to COVID virus, if you're like me, you didn't know. And if I told you the number is 150, that sounds pretty reasonable, right? Maybe more, maybe less, but 150, you kind of work around that, right? That's an anchor bias because the number of children 9 or younger that have died in the state of New York is 2. And I bet you didn't know that. And by the way, 2 is statistically 0%. Now, God bless those 2 children and their families. It's ridiculous I have to say that, because if I don't say it, somebody will say, oh, you don't care about people that are dying. That's called noise, okay? But the signal is the 2 and the fact that it's basically 0%. And again, that's not Ken Montgomery speaking. That's the official data from the state of New York and how they recognize it. And I have a link down here that you can see, or up there, wherever this goes. If we take it out further and we say, hey, how many, what's the death, how many deaths are those under 30 in the state of New York? It's 0.5%. 30 and younger, the percent of COVID deaths is 0.5%. Remember, that's 0.5% of a fatality rate of 0.5%. And again, I bet you didn't know that, right? The reason I say that is there's this anchor bias in order to scare you, in order to us to justify these draconian measures that says anybody is susceptible to COVID-19. You've heard this, right? And the fact is that's just simply not true statistically. In fact, in the state of New York, of the 17,000 people that have died as of today, and that's a terrible number, 90% died from or with comorbidity issues. And of those, 50% had more than one. Okay? What that shows you is, one, that the virus isn't virulent, okay, except in those that it attacks. But then what we saw in some other studies coming out of New York, out of Santa Clara, out of LA, from USC and from Stanford respectively, was that the incidence of infection was far wider than we thought. And that's great news, because that means our infectious mortality rate plummets. So last week, and this is very hard for me to say because, as you know, when it comes to UC Berkeley, I am a defender of the faith. Last week, the University of California, Berkeley put out one of the worst pieces of research. I can't even call it research. Seriously, it was research, it was opinion disguised as research, where they were attacking the Stanford study. And here's what they had to say. Remember about the stats I just gave you from New York. Here's what they had to say. These differing fatality rates can explain the observed higher number of deaths among younger people in New York City. Because the population there is younger than in Italy, more deaths among the young people are expected despite their lower fatality rate overall. The researchers predict that about 26% of all deaths from COVID-19 in New York City will be among those younger than 65. Dramatic pause for effect. 65. I'm 53. I don't consider myself young. I'm young at heart, but I'm certainly not physically young. There's no planet in the universe where somebody who's 39, who's 42, 49, 53, 58, 61, 64, they're not young, and we all know that, right? But you have to really read that, and you have to draw those things together. So that's noise, okay? That's noise. And it's done, and it's intended to get you to act in a way that maybe you wouldn't if you actually saw the signals. And I for the life of me, I don't understand why they did that. It seems like disinformation to me. And I think it's terrible. So we talked about the anchor bias, right? The number that seems right. Now we're going to talk about, we've talked about noise and signal. Think about noise as what you hear from the media, and also that the signal is the actual data and facts that are found in there. And sometimes they're hard to find. There was a second thing that came out last week from a hospital in New York that they had seen a notable rise in young people, young adults, who were suffering from stroke-like symptoms, except there were 5, and the young adults were in their 40s and 30s. And let me go back to the Berkeley paper, okay? The National Institute of Health defines young adult very clearly as somebody between 18 and 35. That is how they categorically define young adult, someone between 18 and 35. Though Berkeley put out a paper that said that deaths of COVID-19 in New York City will be among those younger than 65. It's just intellectually disingenuous. So I want to bring this back to the state of California. I have to say I was very impressed with Gavin Newsom when he first announced the lockdowns. Given the data he was getting, it made sense. By the way, whenever this positive news comes out, we're always asked to peer review it, but there was no peer reviewing of these initial, or very little peer reviewing, if any, of these initial models. And we now know the models are rubbish. Okay? Let me just say this again. Models are not intended to tell you what happened in the past. They're not intended to tell you where you are today. Models are intended, right, to give you an idea of what will happen if you do certain things. And we know they've just been completely wrong. And we're starting to learn about it. But here's the worst part. Not only were they not peer reviewed, they're actually proprietary. So we don't even know all the inputs that go into them. And yet we're basing these decisions to shut down society based on these. It's something I really want you to think about. So again, I was impressed with Gavin Newsom. I was impressed with Californians. We all came together. We sheltered in place. We kept buying from our local restaurants. We supported local businesses. We saved Top Dog, through a fundraiser and through people ordering and whatnot. People banded together. We were able to find ways to have more ICU beds put in place. We housed the homeless, everything. And now we're being told, despite all of that and these incredibly positive outcomes, we have to continue with this thing that is not backed in science, data, or fact. Okay? And you know that's the case because in the governor's announcement today, he explicitly said it. Now, he didn't say it intentionally, but he told us that the number of COVID-19 patients in ICU beds is about 1,200. That sounds like a lot of people, except California has 40 million people. Even more telling, the number of ICU beds we have is 7,200. That means our capacity is 600% greater than what our use is. Again, under no rational terms would you say that we're remotely risk of endangering our healthcare system. In fact, the cure is endangering it because hospitals are empty. They're actually furloughing workers and doctors and nurses. The cure is worse than the disease. And for some reason, we're not allowed to say that. And you'll get shouted down. And people will try and do the noise. Watch it. They'll try and do the noise. Don't let them. Okay? I have great faith in this country. I love this country. I love this state. I love my fellow citizens. We need to come together. We need to be able to say, hey, we need this positive outcome. We need people to say, I was wrong about this, but I'm glad I was wrong about it. And we need to open the state like they're doing in Oklahoma, like they're doing in the country of Colombia, like they've done in Sweden. We need to take that dimmer switch and we need to start pushing it up. Okay, we need to get back to work. We need to isolate and shelter those who are most affected. The rest of us need to be contributing to society to take care of them. I'd love to hear your thoughts. Keep it polite. Don't argue with facts. Otherwise, I'll have to moderate and delete it, but I'd really love to hear what you have to say. Thank you, everybody.